Our next presenter is Dr. Xiao Liu, who will talk to us about biofabrication, a powerful tool for personalized medicine. And I do just want to warn the audience and those online that there are a couple of medically graphic images. So if this will bother you, please step away at the moment. Sure.
Good afternoon, everyone. Yeah, today I will introduce my experience of how we the clinical transplantation of the clinical translation of the biofabrication. So I will introduce how we combine the biomaterial and the 3D fabrication technique and cell therapy to treat the disease. And here is the first example. Here is the patient with the oral cancer treatment. Normally during this treatment, a large portion of a bone and tissue has to be removed. Then this gonna be left the patient unable to eat, talk properly. With proper facial reconstruction, we can help the patient to get the gain their life back. We can fabricate the perfect scaffold to implant this and to reconstruct the face of the patient. And what we do is, first we start from scanning the patient, then we collect the medical images. Using this information, we will reconstruct the 3-dimensional models. Then after that, we choose the proper material to print the scaffold that's gonna be a perfect fit for the patient. And after we implant it back, we can rebuild the face. We can bring the smells back to the patient. In this work, when the surgeon remove the tumor, and we can bring the life back for the patient. This is critically important to improve their lifestyle and for long-term health outcome. And this work has been led by the Professor John Clark from the Crystal Bender Lifehouse, and I have been supported by the Parson Williams Foundations with a middle career fellowship. I will focus on developing a bioresorbable biomaterial that can encourage the newborn formation. And this work is already go to the preclinical big animal stage, and I hope the material I develop can go to clinical translation into 3 to 4 years. And then the next example is the diabetes treatment. As we may know, we have 1.5 million Australians has diabetes, and a large amount of them, these patients have to rely on the daily injection of insulin to control their blood sugar level. Think about the lot of type 1 diabetes patients are small kids. They have to inject the insulin whole life long. This is such a painful lifestyle. This can be treated. Normally in clinical, we found that the islet transplantation, pancreatic islet cell transplantation is a functional treatment for type 1 diabetes. But this method hasn't been used quite a lot. It's because there's a big challenge of this transplantation. Not like a traditional transplantation of a kidney or liver. For the islet transplantation, we just collect the cells from the pancreas. And after implantation, about 70% of the cells lose function or bioactivity because they do not have enough blood vessel system to supply the important oxygen and nutrient to the cells. So what we are trying to do is we try to use in 3-dimensional printing technique and to provide the porous scaffold that's also including the endothelial cells that will encourage the new blood vessel formation. Together, we implant these islet cells together with this supportive pre-vascularized scaffold. We aim to improve the viability and maintain the function after the implantation. And this work has been published on the Advanced Healthcare Material and featured as the cover image. And for this work, we work closely with the Royal Adelaide Hospital. This is one of the 3 function and center that can do islet transplantation in Australia. At the moment, there are only about 30 cases of islet transplantation has been done successfully in whole Australia and New Zealand. But we hope with our novel technique, we can improve this, make this technique more widely used for the patient to improve the outcome of type 1 diabetes. Thank you.
Thank you. Yes, such important work helping people most in need. Is there a question from the audience for Xiao? So, what material do you use to print the vascularization? Can you just explain that maybe?
Oh,
just
I
very
can
briefly?
quickly do that. We do two components. One is the hydrogel-based, one is the hydrogel-based material. One is the cells. These cells we call it endocellular cells. It's an inner layer of the blood vessel. Then when we provide a good environment for the cells, and then cells will self-assemble and form the blood vessel. Yeah.
Oh, that's excellent. Thank you very much. Thank you.